We're going to start by talking about Movember, or No Shave November, that time of year when people, especially men, partake in that month-long journey to not shave and not get a haircut in order to raise awareness about men's health issues and cancer. So in other words, it's a chance for him to be even more stylish than he already is. I'm not at all bitter about that, Doctor.
Well, thanks, Tim.
Yeah. I know you're always having the beard anyway, but yeah, why don't you talk about what it means? It just seems like men in general, we're just more reticent than women to try to take care of ourselves.
Yeah, and it's an interesting story of how this all started, Tim. It started 20 years ago in Australia by two friends who wanted to raise awareness, discussion about prostate cancer.
Yeah.
And it's evolved into, rightly so, this whole month being dedicated to more attention, more awareness, fundraising for men's health.
Yes.
That includes cancer prevention, includes your annual preventative trips to the doctor's office, mental health, all things that men should focus on, which sometimes they don't.
Yeah, they don't. But it's great to see how much it's grown. I even have, believe it or not, my 6-year-old has a children's book, a whole series of them, and one of them sort of deals around Movember, just growing things out to be more aware of men's health, too. What are some of the other big men's health issues? Obviously, prostate cancer, you said, is one.
It is. So here's how I see it. I put it in two buckets. One is healthy living, and the other is screening.
Yeah.
So in the healthy living bucket, what I mean by that is if you smoke, you need to quit smoking. We know lung cancer is the leading cause of cancer death in the country, Tim.
Yep.
And smoking is the #1 cause for lung cancer.
Yeah.
So quit smoking. There are lots of tools out there. Make sure you set up an appointment with your healthcare provider to discuss what options would benefit. Alcohol. Reduce alcohol consumption.
Yeah.
It's at least linked to 5 types of cancers. Obesity. If you're overweight, that's also linked to at least a dozen types of cancers. Mm-hmm. And then if you are out in the sun, make sure you use sunscreen, for instance, because skin cancer is one of the most common causes of cancer in this country.
And is eminently preventable.
Absolutely.
Yeah.
And then in the screening bucket, there are 3 important things: lung cancer screening, colorectal, and prostate. So lung cancer basically applies to those men who have a heavy history of smoking, and if they fall between 50 and 80 years of age, then there's a low-dose CT scan annually that is recommended. Okay. Again, you should talk to your healthcare provider to see if you qualify.
Yeah.
Or if you've quit within the last 15 years but have a heavy history of smoking, you may benefit from a screening test to detect lung cancer. Yeah. Colorectal, we know the recommendations. We've discussed it before on the show, 45 to 75 years of age. Talk to your healthcare provider to see when you should start colorectal cancer screening. There are multiple methods that you can that can be deployed, as well as frequency of screening. And then the last one is prostate cancer. A little bit more controversial, but it applies to those that are average or higher risk of developing prostate cancer. If you have a family history of prostate cancer, if you're black. So again, things to discuss with your healthcare provider.
A bit of a segue here. We're talking about healthy living and screening. It's also World Pancreatic Cancer Month. Pancreatic cancer, easily one of the deadliest cancers there is. There's a lot of problems. You were saying right before, not a lot of screening options here, and it's tough to detect early before it's too late. So it looks like we want to push all of our chips into just healthy living just to try to reduce your risk.
Absolutely. Great point, Tim, because we know for pancreatic cancer, some of the same risk factors, whether it's alcohol that can lead to chronic pancreatitis or smoking, or obesity, all of these things are things that we can modify, risks that we can modify, right? And these are all some of the causes for pancreatic cancer.
Yep, and unfortunately that healthy living, like we were just saying, to wrap things up and bring things full circle, that just tends to be the things that guys are not as diligent about.
That's right. Make that appointment with your healthcare provider.
Absolutely. Do it. I was even saying before, I know it kind of sounded gross, but obviously I'm not partaking in No Shave November. Trust me, everybody's better for this, Erica. But at least I got my physical a couple of weeks ago. Granted, it was in November. Scheduling a colonoscopy. The age is now 45, not 50. I'm 47, so it's going to be a first for me. I'm trying to do my part.
Absolutely.
Yeah.